Okay, we started recording. Perfect. Okay, thank you so much.
Thank you.
Great. So apologies, I will ask you all to just restate your name just for the record so we have it on the recording. So starting again with Simone.
Simone Sylvester, committee member and board member.
Thank you. Sabin.
Sabin Jacques, committee member.
Thank you. Ms. Reed.
Janice Reed, committee member, former board member.
Ms. McCain Brown.
Monica McCain Brown, committee member.
Ms. Harris.
Ruby Harrison, committee member.
Great, thank you. And D. Gay, are you able to try and unmute now? I did see your message that you're not able to unmute, so we will just mark you down. Could you put your full name in the chat just so we can have it for the record, please? Okay, so continuing with the chairperson's report. So starting next meeting, we will have a CAB representation from Brookdale, and then either in person or on phone representation from the Kings County CAB, or a report that is shared. The other thing I wanted to share was to talk about the hearings, the open committee hearings that have been happening at Downstate. I asked Diana Gay, thank you. I asked the board staff to share an email about an event that happened last week, and I think everyone should have gotten that email. And there was a hearing at Downstate to talk about what the $750 million investment from the governor would look like, where the community wants the money to be spent. I did attend in person. I was really happy that it was very, very, very well attended. The seats were full, which is great. But I think that one of the drawbacks of the meeting was it felt like people were there to sort of share their vision for, or share their reasoning for why Downstate should not close, but Downstate is not closing. Like, that decision has officially been made. And the purpose of the meeting was really to talk about what the community envisions the investment looking like now that we know Downstate is not closing. So they will be having another hearing in February. I am, intending to attend again, barring any scheduling conflicts. So I would like us to discuss during new business some of our ideas as this committee that we can present. I can help compose a letter that we will present at that meeting for things that Community Board 17 members would like to see from Downstate. And then the other portion of my report is that next meeting, hopefully in February, I'm hoping to have some outreach from a breast cancer organization, Share Cancer Support. They had reached out to the board that they were interested in doing some work. So I'm hoping to have them attend to share some cancer resources, going to try and just push out the information of the meeting more so more people can attend, but also they will have like printouts and emailable resources that all of the committee members here will get so that they can be shared with, people in your networks as well. And that ends my report. Any questions about anything I just talked about? Okay. Next, we would like to approve the minutes. The December minutes were shared by email. Could I please get a motion to, or it looks like these were the November minutes. Yeah, we didn't have a successful meeting in December. So could I please get a motion to approve the minutes?
Simone Sylvester, motion to approve the minutes.
Thank you so much. Is there a second?
I'm sorry, were the minutes sent out? Because I never received them, so I can't.
Got you. Yes,
see
if
them.
you got the email, it went out a couple of times, but there was one on Thursday, January 16th, that went out, and then again this afternoon at noon at 12:06. That email has the minutes attached in addition to the agenda. Sorry, Ms. Reed, were you looking for the minutes?
Yeah, I actually just scrolled back through my phone and I found that you're talking about the November 25th,
Yes.
2024 minutes. Okay. Okay, I can second that. I just read them.
Thank you so much. Those in favor of approving the minutes, please say aye.
Aye.
Everyone else, please.
Aye.
Okay, I believe the minutes are approved. Thank you all so much. So next thing would just be new business. Does anyone have new business that they want to bring to the floor before I bring it? Good evening, Mr. Daly. Welcome to the Social Services Committee meeting.
Good evening. It took me a while, but I got here. How are you? Good evening, Sheriff.
Welcome.
Sheriff, how's everything going?
We're good. We're making it work. Can't complain.
Exactly.
Yes.
Hey, everyone. Good evening, all. Let me step outside for a minute out of the noise. Give me 1 second. Just a quick announcement regarding downstate that one, there was a meeting last Thursday where the community was introduced to the panel by the governor. The person that's representing the community, her name is Claire Patterson Mona. She was selected through certain research. There are a number of other people on the committee. The governor had there were approximately 9 people on the committee. The other thing is on February 27th, and everybody will get the flyer on February 27th, District 9 will be hosting the community session on February 27th. The location has not been posted yet. As soon as that is posted, we'll give it to Chair Oni so she can discuss and send out to the community. Also, I'm looking forward to the fair that the social service put on every spring. So I'm looking forward to that and to participate with that. And any help needed, please do let me know. Whatever, there are a couple of other things without in terms of seniors and letting us know what's going on, what's happening for our community. By the way, they're going to open up at a cancer piece at downstate as well. Jointly with working jointly with Maimonides Hospital. So just looking forward to that, man. I think that's it. And thank you, Chair Oni.
Of course, thank you. Okay, I looked up and we have another member. Brenda Jean, could you please introduce yourself for the record?
Hello, good evening, everyone. My name is Brenda Jean, Community Board 17 member.
Good evening and welcome. Thank you. And the person with the 610 number, would you mind introducing yourself, please?
Hi, my name is Vanetta Sylvester, and I recently signed up to be on the committee.
Okay, fantastic. Welcome. Thank you. I'm happy to have you all here. I'm sorry, I didn't catch your first name. I heard Sylvester as the last name.
Oh yeah, my first name is Vanetta
Finetta with an F?
with a V.
Vanetta. Okay, great. Thank you. Welcome and thank you for joining. So as the chair mentioned, for new business, one of the things I did want to discuss was the upcoming meeting about SUNY Downstate. And so, as I said previously, the committee currently wants input on what community members want to see at Downstate. So I just wanted to open up the floor for some discussion on things that we can bring to the committee, as CB17 Social Services, on behalf of CB17 to say, these are different ways that we think this investment would be well spent to benefit this community. So, the floor is open for thoughts. So I can start. Brenda Jean, please go ahead.
I was just gonna ask, what have they already proposed in terms of improvement for SUNY Downstate? Because I've actually I've been a patient of SUNY Downstate and for two different major surgeries and life episodes. So I know how it is to be a patient there, and also have family members who work as RNs, you know, within the New York City health and hospitals. So I know what is needed at SUNY Downstate, but I want to know what have they proposed in terms of improvements already before we, give our opinions.
I would say there are general improvements on the table, like, cleaner facilities, upgrading electrical, upgrading the beds and that sort of thing. But I think that there's room for you to just share your experience so that we can, because I think they want the experience as well, because you're saying you've been a patient there. It's helpful to say, like, as a patient, I've seen X, Y, or Z. So you can feel free to share that information. Good evening, Ms. Douglas. Welcome. You're on mute, but I see you're saying hi. And I can turn my camera on if I'm going to be on camera. So welcome. And Ms. Douglas, could you just introduce yourself for the record, please? You're on mute.
1 second. Judith Douglas, Lord.
Okay. Are you a committee member or a community member or board member?
Community member.
Okay, fantastic. Thank you. So Brenda Jean, back to you. What have you experienced at the hospital that you think needs to change and improve?
In terms of scheduling, I see they overbook patients in every department. So it's always crowded, and then they have a long periods of wait time. So you could be at an appointment for 10 a.m., but you won't leave SUNY Downstate until like 2 p.m. in the afternoon. So they overbook, and then they have long wait times in terms of patients being seen. And then your appointment typically lasts probably 15, 20 minutes. So you were there for 3-4 hours for a 20-minute appointment. So it's in terms of just scheduling, I guess staff, also medical records being more accessible and understanding them, and also the way of care seems to be more so not how you say it, not so much what the patient wants is they always seem to just go what they seem as a better option, and they never think they never weigh that alternative. So they might say rush you into surgery, but you could have just took a pill or had holistic treatment for your particular situation. So they also don't have alternatives. Also, a lot of their quote unquote doctors are residents. I understand a lot of hospitals do that, but there has to be more than one doctor for the department that the residents are answering to, because doctors sometimes not even on shift. And then it is a lot. I see why they're pushing to close it. So I'm sorry, but I see why, because it's long periods of wait. The equipment is outdated. They have outdated equipment in terms of medical facilities. The equipment is outdated. The facility is old. They don't invest that much into the structure, it seems like, and individuals are there for a long period of time and not being seen when their treatment lasts probably 30 minutes. So yeah, so they need staffing, they need new equipment, and they just need to learn how to facilitate patient management, how to manage patients better.
Okay, thank you. It's helpful. Anybody else? Thoughts that we can bring to the meeting?
This is Benetta. I just wanted to say, as someone who's worked at the hospital, I agree. And I think that the community needs to do more and be more vocal, because I've had that perspective of being told these complaints by people getting their care. And I said, well, why don't you bring it up with the administration or, patient relations that you're having these issues? Oh, we don't want to be a bother. But it's really important to, especially for things like complaining about the facilities or, the issues that, are out of the hands of the people that actually work there, to be able to make a big change about it, because the SUNY system is under the governor. And the more that's said to community leaders and elected officials about what is going on in terms of the facilities need to be updated, the equipment needs to be updated, the staffing numbers need to be improved, and the more they hear it from people who are actually getting their care there and not just from the staff, where it sounds like a broken chorus, the more effective it will be in getting these issues addressed.
Okay, thank you. Can I ask what capacity you worked at Downstate?
As an OBGYN.
Got it. Okay.
And those nurses are doing miracles with very little staff and, equipment that's, not up to date, or facilities that are at the end of their lifespan.
Thank you. I'm taking notes on, what people are saying. Improved equipment at facilities. Okay, anyone else, thoughts that we can bring to a meeting about? improvements
Yes,
for
this is
Downstate?
Savin. I'm not going to go into the granular detail, as both of the members have done a good job outlining. For me, it's an understanding of priority, because whenever I hear we're going to, you want suggestions somehow or the other, and I can't help but say this, whether it's project management, bucketing, what's the priority? Because administrators can speak, patient surveys are done. I've also been in the healthcare field. So all of the information, all the data that is gathered, how does it turn into information, and how does it get prioritized? Because I know you're doing a great job taking this information, taking this data, putting it down, presenting it, discussing it. But what is it that they have in their mind? And I think it's best to communicate at that level, and they can trickle down to us, so that we can actually have some good recommendations from the community. A lot of time what I find is we collect data, we talk, however, implementation and execution is a challenge, something gets lost. And I think, without me being verbose, I don't always find there is a great outcome at the end of everything. You understand what I'm saying?
I sure do. I think I'm trying to, speaking from the perspective of having attended the last meeting, my understanding is that this is really the information gathering stage. And this is almost like the time to dream a little big, just because they're really just trying to get ideas. Like, what does the community want to hear? And then I think that once they've taken all of those inputs, the action committee that's designed to work with the governor will then prioritize. So, I think that there's like a general understanding facilities need to be improved, et cetera. But one of the ideas I was going to share is maybe creating some sort of a medical education outreach program where doctors from downstate go to local public schools and talk to kids about having careers in medicine. And I think like we can take those kinds of ideas to them, again, with respect to how they spend this increased funding from the governor, to say like, this is what CB 17 people want to see. And then it is on us, me as the chair of this committee, but then also just us as community members, to hold them accountable to the things that they've said. But again, the meeting last week, in my opinion, wasn't the most productive, because it was really like emotional. Like, people were just talking about, I was born in downstate, or my kids were born in downstate, and downstate's really important to the community, and we need downstate. And like that's all, very valid, but the governor has decided that she's not closing it. So knowing that, the next question is really just this sort of community listening stage. But I do very much hear your point, and like, we don't want to just spin our wheels and feel like we're talking to nobody. So I think that would be like the next step after this first information gathering stage. Chair Daly, I'm curious if you have a different opinion, having also been at and spoken at that meeting.
I was going to add a couple of things. Yes, I think, yes, I mean, because of the setting up of the panel, there was a lot of venting. I think that's the word I would use. There's a lot of venting, but there are also some suggestions as well, and also reminding the community of some of the benefits of having downstate in the community. One of the things I want to make sure that we're clear about is that there is a community representative on the board, right? Cleopatra Simona. She is there because of the community, and not she's there to let what ChairOni's talking about, which is what are the community needs to ensure that downstate remains open, not just open, but open to needs. So some of the suggestions that were there is to improve the maternity ward, give some people some dignity, like, you know, have some more private bathrooms, build rooms with private bathroom. I think parking might be also important because people are coming to visit. So maybe put up maybe 2 or 3 floors. And it's $750 million. I don't know if Chair Oni had mentioned that. So what are we going to do with this money? Right. So I think what Chair Oni is asking for is direct, specific things to spend the money on. So some, like I said, some of the suggestions were more dignified for maternity, maybe increase and improve the size of the emergency room, right? And change the furniture, right? Increase staff. So one of the staff persons that were there, she mentioned, you know, there's a contractual number that is supposed to be for patients to nurses, right? That number might have to be looked at to increase the staff. I think one of the person on this committee mentioned that they have a lot more residents as opposed to attending, and they need to increase attending. But be mindful that it's also a teaching hospital. So those students have to have the opportunity to learn as well. So just some more things to think about, right? More things to think about. How will it be more of a benefit to our community? And if it doesn't get done, then we hold the community advisory board accountable for that, including Commissioner King and everybody else who's on the board.
Thank you.
Just have a
Uh,
suggestion. I just have a hello.
Yes, go ahead, Mr.
I
Douglas.
was recently at the hospital on Sunday because I wasn't feeling well. And I can tell you, I think number one, the community needs to be respected. And I don't think they get that. See many of the residents coming from out of state, and they have so many young people apply to become put in the application to be adopted in those hospitals, and none of them get called. Many of them don't get called, but every single person I spoke to at that hospital, they're coming from out of state. So we have to start looking at our internal people who are within our community and giving them the opportunity. Yes, they for the weekend, there was a lot of chaos, limited staff members, one supervisor, and it was just chaotic. Everybody's pretty much was overlapping because they don't have enough body, and they have emergency, and there's not enough people to help with emergency, and people are sitting there for hours. And in other hospitals, you don't see that problem because downstairs is not the only hospital that I visit. You don't see that at other hospitals. You have enough workers. You know, you have staff to patient ratio, and they need to start looking at that because people become frustrated and acting out, you know, and that's not a good feeling to the community. So those are things that have to really change. The bathroom is filthy. I was in the bathroom to change. You don't even have a hook to hang your personal stuff up on. You really have to put them on the ground, and I'm not about that. So I have to be creative and find a space to hang my stuff up on the door before I can change. It does lack a lot of service, and I know every second downstairs is always on the chopping block, you know, for whatever reason, to close out of the community. We do need downstairs, we do need Kings County, but at the same time, they have to first start respecting the community at large, give opportunity to the local people those young people are coming out of college, trying to get an internship. They need to help with those things. And those are from my perspective. Everybody have their own opinion, but those are mine. And they're valid and I've seen, so I need to put it there too.
Thank you. Making a note of some of the things you mentioned. I appreciate it. Ms. Reed, please go ahead.
Yes, good night, everyone. In addition to the staff, but I don't know if they have I know they do have it's a teaching hospital and they do have residents and interns, but I don't know if they've ever looked into nurse practitioners to assist as well, because that can also to help to kind of take some of the load off the residents if there's also to a caseload to share, and definitely staffing in terms of the nurse patient ratio. That also would need to be looked at as well as other persons mentioned the physical conditions. Maybe they also too, I don't know if they also too have training, have nursing, like nursing students coming and partner with the nursing students, since they have been now going to be partnering with Maimonides for an oncology unit. They'll definitely need also to, they could also to, look into having some nursing students come in, because we do need more nurses. And if you open up the specialties, especially now outpatient, to nursing students, then when they graduate, then they can be hired. So they can also look into that as well if they have not already have a partnership with a nursing school as well. So to help to increase their staffing.
Okay, thank you.
Hi, I'm not 100% sure, but I think as a teaching hospital that they do have a school of nursing and they do have training for nurse practitioners. So I think they are people that are on staff that are doing nurse education for nursing students. And when I was there, I do remember some of the nurses were also trained to be nurse practitioners. So they were doing shadowing with some of the docs.
Okay, thank you. So in that case, what would be like, maybe Ms. Reed, come back to you, what would be a recommendation or request that we have out of the nursing program?
I would say that one of the big complaints that I've heard from staff at Downstate was that the overall benefits were good, but the salary was not on par with a lot of the private hospitals.
Okay.
And so that would be an issue in attracting people to work there after they graduated from nursing school.
Okay. Thank you. And Ms. Douglas, to be clear, one of the things you mentioned that I wanted to make sure I noted down was basically saying that you want to see more hiring of people from the community.
Need to see more people looking like us in downstate, not only just county too, but let's focus on downstate. We need to see more people. I know there's I don't know if the executive director, whoever is there, I think his goal was to bring in a lot of minority. I don't see none of them. Every time I go there, it's always people from a different state. I was like, wow, people coming in, but nobody's taking from the community. That's not right. It's not reflecting about who we are. We need to see us. We need to be happy going into an environment where we see our people helping us,
Okay. Yes, I agree.
We need
I agree.
we need a balance. We need a balance.
I agree. I think that's part of the reason why I was suggesting some sort of like medical student outreach, because I think that there's a pipeline issue to make sure that like students from our community and similar communities are encouraged to go into medical education and then can apply for internships and residencies at Downstate. So I definitely agree. Just want to make sure I had that noted down. Any other thoughts on this topic before we move on?
Monica McCain Brown.
Yes.
I just want to say what Ms. Douglas just said, that's what we've been seeing for a while. But in terms of recruitment, especially in terms of doctors, the health field has become very difficult now. And people are now going more into technology, and it would be good to see some of our people, as you said, doctors. I think it's a little easier with the nursing, but the doctors and what they pay out of grad school, etc. I think what I have noticed, let me say, is that when we see others, their parents have been doctors, for instance, just like in law these days. because it's become very expensive and most doctors are now going into specialty fields. So looking for that friendly doctor that we would have seen years ago, etc. I don't think we've seen that. And I think that's a very sad piece. Because like education, I think if you're in the health field, you need to be compassionate, caring, and we need to see people who you're familiar with when you go to the hospitals. I think it makes you feel more comfortable, as was noted. You don't want to go into a hospital, you're already sick, and then there's chaos. I mean, it brings more stress on that person who is not feeling well already. So I've been listening, and I think a lot of things again said, but people in your community need to be treated with respect, as has been said, and we have to find people who are familiar with us, who know the culture, whatever, to work with us. But I think it's difficult times in terms of getting some of these, but respect, first of all, starting off, and of course, the physical conditions, because you don't want to go to a hospital again and there's no cleanliness, it's spilled, etc., etc. So my other thought is when the advisory committee gets what is being presented, the data that has been accumulated, etc., and it's presented, I guess it's going to be presented to the governor's task force or whoever. The next hope is how are these ideas become reality and implemented? Are all these things that are being said here, will they be considered? Or other things will be prioritized based on who is looking at the information? And I think that's another concern, at least for me. What is going to be done? All these things that have been collected, how are they going to be prioritized? Is it based on those people who are looking from the outside in or from the community where it's coming from?
I think that's a valid question. I know Chair Daly mentioned, there's at least one community representative on the panel, but I think it is up to us, as community members to press the downstate committee for more information as they continue to move forward. I don't know what the timeline implementation for this investment is for the 750 million, but I imagine it'll take a few years. So, that's the other thing is that a lot of times people would be really, yeah, go ahead.
I was just thinking, one of the things I think about what I can do is connect you with Claire Mona, Chair Oni, and then you could invite maybe to next month's meeting, because I think I'm not sure of the date of February 27, but they do meet and they do debrief. So if you're able to connect with her and present her with some of these ideas, they need help to move forward. Some of the suggestions that are part of the implementation plan. And by the way, I just want to add one thing to all the committee members. The committee made a lot of input into Shirley Chisholm Recreational Center, which is being built, and a lot of those suggestions were taken into play when they were building the center. What went in there, the track, the pool. So don't think that your suggestions are going to go unnoticed. So don't believe that for a minute. I just want to make sure I add that.
Thank you. Can you please connect me with her through email?
I will. We'll talk about it after the meeting, maybe tomorrow. Just send the contact numbers and things.
Okay, sounds good.
All right.
And I want to highlight, when I was there on Sunday, there's some workers who supposed to be looking at it constantly on their phone. Even when they answer the phone, they have their own personal phone going on. You know what I mean? I was like, what's going on here? Are you working or you just having, a fun day? They got to take this job, CPR, professional respect. We need to have that. This is not your home. You have to separate. When you come to work, you put that phone aside and knowing you pick it up for emergency, not to be on it to chat with a friend, because it was a professional conversation. That's something we need to change. If we can't change the system, we will never get changes that we're looking for.
So, importance on staff training, yeah.
Yeah, especially the non-clinical patient-facing staff. That is a big issue. And I noticed when I was there, in terms of like schedulers or people that greet you at the front desk, sometimes they can be a little more professional or helpful.
Okay. Sabin, I see your hand coming up and down. Did you have a comment?
Sorry, I don't know if you can hear me. I do have I think I'm just trying to work lean on this because I know you're great as our chair representative. Um, I cannot imagine that a lot of what we said has not been brought up in surveys. There's a reason why I'm saying this. So whoever is compiling and putting all of the data and information together, as they go through their surveys, and I know there's going to be a lengthy process, I hope this doesn't take forever. If they
Mhm.
do a gap analysis with what we're saying from a community perspective with all their surveys, hopefully they will work lean so they can tackle some of these things. Because again, whether you've been a patient, whether you've been a person visiting somebody else, or even somebody making a comment on some board somewhere, this information probably exists somewhere. What we're trying to do, and I hope that it's not to delay. I mean, if we hear about the money, they're going to have project management, they're going to get input. I hope they can give you an established timeline and kind of organize it with a real task force because they have this information already. So we are repeating ourselves, and it's great that we are talking, but we want effective action. That is something that I'm always disappointed by. They hear from committees, they hear from chairs, they hear from recommendation, and then there's a crawl, and then there's no expedited execution. I'm just saying it, so please, that's something I think is important.
Mhm. Yeah, I agree. And I think I appreciate Chair Daly's point to actually for this committee to actually speak to a member of that committee to kind of express our concerns about action and accountability and stuff, and so that we can really be in close communication with that team. Because what I was trying to say earlier is assuming this is a multi-year timeline, I think another issue that often happens is people's attention span wanes, like people like us, right? And then we're not there to keep them accountable over the next 1, 2, 3 years. And I think we need to be able to do that. But by having a direct line of communication, it would really help us do that. Okay, any other thoughts on SUNY Downstate before we move on? Okay. The next piece of new business I wanted to discuss is, as the chair mentioned, because he likes to steal my thunder, our April Health Fair. So currently working with the board office to settle on a date. It'll likely be the second or third Saturday of April, when there will be, some decent weather outside. And so last year was my first year hosting the health fair, and it was the first time we had the health fair since the COVID pandemic. So I think it was okay, but could have been better in terms of attendance and the vendors that we had. So I'm just again want to open the floor to people's thoughts on what we can do for this year's health fair, or what you'd like to see at the health fair, and then also specifically what you as an individual can help contribute. Like, do you have contacts that you think could show up? Do you have organizations that you have ties with that you want to recommend we reach out to, just so that we can get a jump on that planning over the next couple of months?
Simone Sylvester, board member, if we could reach out maybe to some of the independent small businesses, like the health clubs, like Fringe, for Pilates, and instead of like the bigger chains like New York Sports Club.
Okay. Sounds good. Anyone else? Any successful events that you've attended that you feel like there are portions of it we can we can imitate for this community?
So this is Simone again. I work in the Bronx, and every couple of weeks they have something called the Bronx Night Out, or the Bronx Night Market. And it's really all things the Bronx, of personal chefs, a lot of vegetarian cooking, and information, and just almost like a gathering of small businesses that are oriented towards improving the health and the well-being of Bronx residents. And I actually find them to be very helpful.
That's a good point. I think one thing that I'm struggling with is how to differentiate this event from the board fair that happened for the first time last fall and then God willing would happen again this fall. That sounds a little bit more in line with the board fair, like having small businesses and you know, we had food demonstrations and such. Whereas historically, to my knowledge, again, I only have hosted one of these. This one focuses very specific on health resources. And the other difference being that the board fair was like a street closure, whereas this one just is on the sidewalk and we're not closing the street necessarily. We can close the street if we think that it's worth it, but you know, that takes a lot more work. So, I mean, I'm kind of just thinking out loud, but that's something that's just been in the back of my head is what does it look like for this board to now be hosting 2 outdoor events? And how do we differentiate the two?
Yeah, I'm not sure. Do you feel you have to differentiate between the two?
No, you don't have to. Definitely don't have to. Ms. Reed, what are your thoughts? I see your hand up.
I was just going to say that it's a correction that the last health fair was in 2022, that was after COVID. We did
Okay.
have it in the park, and I know you're saying you have it in April. Having it around the board office, sometimes that kind of tailor, because it's can tend to be kind of congested there. I don't know if you can get the park again, so you can have a spread out. It's always a good to attract persons, and if you can get the mobile I know several years ago we had the mobile van for the mammogram, and I also tried, and it's kind of hard to get the to do the blood to donate blood as well. Sometimes those can be attractions, along with getting the hospitals to come to do the screening, the blood pressure screening. I know that downstate has a hearing department that do outpatient hearing tests, because my church had a health fair last September. They did come and did hearing tests. So if you can, they can you can utilize that as well. That's always something good. And then if there's any deficits, you can also they'll have you come to downstate for follow-up. So I think the attractions with the hospitals is always a good thing. Along with obviously the other vendors, like the health, the insurance companies and stuff like that. But I think you have to have something to draw the community, because it can be a tedious process. You have all these vendors coming and you don't have many participants. So I think having something that will draw them, like maybe breast cancer screening.
Yeah,
That
thank
be
you
a
for
draw.
that. And thank you for the correction. What park was it held in 22?
It was across the street, the park for the board.
Got it. Okay. Mr. Daly?
Just a real quick addition. One of the things that we now have the constant contact that we're using, so we're going to utilize that to increase participation. But I also would like to say for the committee to see if they can get their friends to be part of the community board, not just join it, but join the committee, and then spread the word. So like each person say, hey, I would like to get you introduced to the community board, especially the social service committee that works with these different things, blah, 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 and have them send in their information so that they can be part of the constant contact, so that they could get the information, as Ms. Reed said, more visibility, right? More visibility in the community, at the churches, make them become part of maybe you could create a little card, and with that card, you could give it to a church member or 5 people. Take 5 cards, give it to 5 people, and give it back to the board, so that these people can all join, so that you can have the opportunity for them to come out. And there are a lot of, I think, a distinction between the community fair is that the community fair has all components of the community, while the social services is about health, that are about services that are applied from certain agencies. So obviously there will be some overlap, but not not complete overlap, but right between the two, but because they're more, it's supposed to be more community, more committees involved with it.
Supposed to be. Yeah.
Yes, I know that's the word supposed. We're gonna use that word.
Yeah. Sabin, I saw your hand come up and down.
Sure. I hope I'm not, so this is something that I thought about and I don't know which it should be in terms, because you were just, somebody was asking about the two differences here. I think it's important that when we talk about social services, health and community, that we think about ways that we're like action oriented. Like, for example, I always say this, if people can use social services, but they don't know how to, for example, walking, right? We want people to eat healthy. We want people to lose weight so that they obviously don't end up in the hospitals for diabetes and hypertension. And then, so the question is, how do you get that done? So maybe like forming a buddy team, something that's really action oriented, because so much of our stuff is driven by that. And even as we're talking about, we want people, again, to stay healthy, even if they're using wellness services. There are wellness services as part of social services. We don't talk enough about wellness. How do you do that? You encourage the restaurants to have different healthier options. And again, I'm just saying healthier for those who want to, eat differently. It's, it's not necessarily just vegan. It's just thinking differently about when we are marketing ourselves in the services, that we also kind of include things that people are not just taking and not really following. I don't know if I'm saying this clear enough, but that's my point. I always want the action oriented, whether it's forming a group to do a walking buddy, whether it's somebody that you eat lunch with, something like that. I'm trying to say, to keep the healthy, being healthy and maintaining wellness.
Agreed. Mr. Daly, your hand is still up, or oh, you have to go.
No, I should have taken it down, but
Mhm.
I am actually gonna have to go. But I just wanted to leave one thing. I'm sorry, I've spoken a lot, but just to remind members to visit the board website. We're still looking for community associates. So if you know somebody in the community who's looking for a position to apply for it, it's on the website. The link is there. Also, we have a number of other committees that can use your support at the community base. And come to the general board meeting, which is the third Wednesday of every month. And thank you so much, Chair Oni. This is a great meeting. I enjoyed myself. Thank you.
Thank you. Thanks for joining.
Mhm.
Ms. Douglas, go ahead.
So for the community fair, is it going to involve kids going to be part of this?
Last year we had kids come by. I mean, it's outside, so it's kind of just depends on who shows up. Last year we did have kids come by. We did have kid oriented activities. I'd say we probably got like maybe 10 to 15 kids passing by total. But I will say I have learned a lot in the last year, and so we'll be doing a lot more to just overall increase attendance. But that's kind of the turnout last time.
That's what I was asking, because if we have kids, we probably have to have somebody to engage, but you did activities for them, so that's good.
Yeah,
also,
both events that I've hosted, I've had like a
Right.
kids table.
Also, do you partner up with the Department of Mental Health and Faith-Based Organization?
Yeah, they're on our list. So typically, how this has happened to date is we have a list of organizations, agencies that have worked with the board in the past, and we'll just email them with the date asking them to come. So health and mental
Okay.
hygiene is on our list. I don't think they made it to the last event, but they are,
Okay.
they are invited. Yeah.
Okay, so if I get the correct date, I will remind them, because I'm also part of that committee. So once I get the correct date, I can always put it into a larger form where everybody's there.
Okay, I will be sure to share that. Okay, any other thoughts for things that we can look to include for this year's health fair? Nope. Okay. This is all very helpful. I'm just gonna, sort of compile notes and keep moving towards that date. I will share once we settle on a date with the board staff, I will share that around with the group so everyone knows and can bookmark it. And then next meeting we can talk a little bit more about like assignments and what people can do. Ms. McCain-Bryan, I do see your hand, so please feel free to talk.
That was by accident, as my daughter would say.
Okay, no problem. Okay, so that is all I have for new business. Always appreciate the participation, appreciate everyone's attendance today. Is there any unfinished business that anyone would like to bring up? Okay, hearing none. I think we can now adjourn this meeting. Can anyone make a motion to adjourn?
Meeting.
Thank you so much. Is there a second?
Second.
Okay. Just thank you again, everyone, for attending. Really, really appreciate the conversation. I will follow up on email with all of our next steps and looking forward to chatting with you all next month. So have a great afternoon. All in favor of adjourning, please say aye.
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 Bye.
All right. Have a wonderful night, everybody. Thank you so much.
Thank you. Good night.
Thank you.
Good night,
you.
everyone.
Good night.